Hi, I'm Kyan Safavi. I'm the MGPO Torchiana Fellow, and we're here today talking about capacity at MGH. Addressing our capacity challenges is really a #1 priority for the institution this year, and it's really a patient safety issue. Making sure that patients can get timely access to the expertise and services that we provide is extremely important to safe care, and in many instances only we can provide that care. So it's not only a service to patients locally, but also throughout the region. And I'm joined here today by Peter Dunn, who's the Vice President of Healthcare Systems Engineering and Perioperative Services, Ben Orcutt, who's the Director of Patient Access Services, and Donna McEachern, who's the Nurse Director for Central Resources, the Clinical Nurse Supervisors, as well as the ED Boarder Service. So thanks for joining me today.
Thank you.
So I wanted to start off by asking, the three of you have coordinated and led a lot of our capacity initiatives this year. What brought you together in this collaboration? What are you guys trying to accomplish?
Sure, I'd say this partnership has really always been there. This is just an effort to formalize, strengthen, and evolve the partnership so that the entire institution is aware of it and can benefit.
Excellent.
And I would just agree there that formalizing this collaboration really makes sense in this time of increased hospital demand. And working together, we think as a team will be the key to unlocking the capacity challenges that we face.
I agree, and I would just add that the team-based approach and the formal structure is essential for us to be able to integrate capacity management into our daily work.
Okay. So the Capacity Operations Committee was convened earlier this year by Dr. Slavin with the aim of really having that body help coordinate some of our new efforts in capacity. So I wanted to ask maybe, Ben, if you could share what are the aims of that group and what's it trying to accomplish?
Yeah, the group was formed really to organize and oversee all the efforts that are going on in the areas of capacity, as well as to inform and communicate in both back and forth with the Daily Operations Committee.
And maybe Peter and Donna, you could give some examples of bodies of work that the committee is currently undertaking.
Okay, so I'll talk about bed reallocation because that's a major part of our work this year. We utilized computer modeling to both simulate and optimize what would be the right number of patients for each service in order to minimize off-service placement and also maximize hospital capacity. We've just finished the first of 3 phases of this work, very successfully having transitions with Bigelow 14, Ellison 16, and Ellison 19, and we're looking forward to completing this work over the course of the year with the second 2 phases.
Another area has been discharges. They're a challenge for all of us. Timely discharges are critically important for us to help unload the congestion that we face each day and our length of stay challenges. The Capacity Operations Committee is working on several different tools that will make that process easier and transparent for everyone across MGH.
That's great. So the capacity physician is a new role that was initiated earlier this year to help address some of our capacity issues. I was wondering, Peter, if you might explain what is the capacity physician and what role does it play at MGH?
Yeah, the role is new to MGH, but this institutional physician role is common in other AMCs like Mass General. The role really is a partner with the admitting and the nursing supervisor teams to help address the capacity challenges both intraday and design systematic solutions for the long term.
And maybe you could explain how the capacity physician interfaces with both patient access services and the nurse triage supervisors on a daily basis.
Sure, from the patient access perspective, the Capacity MD is a valuable resource in dealing with complicated hospital transfers, physician communication issues, and really just overall patient flow issues.
And so for the supervisors, we interact with the Capacity MD daily. The communication is bilateral, sometimes initiated by the Capacity MD, sometimes initiated by us. And we're trying to when we're trying to resolve a difficult patient placement scenario. And we found it to be really great support to have a physician focused on capacity for the hospital to be able to be part of this work.
And Peter, maybe you could explain how does a clinician get in contact with the capacity physician, and when should they get in contact?
Yeah, so the capacity physician is available 24/7, and it's available to anybody. when they're focusing and having challenges with access to care for patients or patient throughput, when the normal channels of operations just are not working. We can be reached through the page operator, Capacity MD, or pager 23556, or via email capacitymd@mgh.harvard.edu.
Great. So, I think capacity is really a team effort. Anybody that touches the care of the patient really can help them progress through their hospitalization in a safe and efficient manner. And so, one thing I wanted to ask each of you was if you could give maybe an example or a piece of advice about how any of us at MGH can help make the capacity effort go forward.
Sure, I think it's really important that everybody in the institution does understand that every bed really does matter, and when we free up a bed for that next patient, the value in that is tremendous for both that patient and their family, and of course our colleagues.
And I'd just say that sometimes it feels like focusing on patient throughput is incongruent with providing excellent patient care. And what I think we need to think about is when everyone works hard to move patients through the system, we make a smoother experience for our current patients, and we make room for the patients who need to come to Mass General.
I would agree. Quality care is timely care, and everyone needs to do their part to make the system as efficient as possible. And the new MGH Capacity Ops Committee is here to help everybody support and achieve that goal.
Well, that was awesome, and thanks for joining me today. And we're looking forward to all of us helping with the effort and also seeing many of the large initiatives sort of move through this year. So thanks for joining me.
Great.
Thank you.